Hughes here, and joining us now, both on the air and on SuperTalk TV, we have Dr. Christina Williams, the clinical director of Pine Grove Outpatient Services, licensed psychologist, and overall a wonderful person. Now the pressure's on, Doc. You've got to live up to that introduction. How are you doing today?
I'm doing great. Thanks so much for having me.
Most definitely. And I'm going to be honest, I could do the entire hour with you, so just buckle up here.
Oh, that's
Mental
great.
health is a big thing that doesn't get enough attention. May is Mental Health Awareness Month, and boy, do we need it, and do we need to focus on it, because I don't think it gets the attention it deserves. Would you agree with that?
Absolutely. I mean, we have a month for a reason, and this actually started back in like 1949, and so for decades we've been trying to bring more attention to this, and so I definitely think that shows like this, definitely help. The willingness to talk about it, to reduce the stigma, it's so important.
Well, what you just said there, that word stigma, is at least 50% of the problem, I think, because we have, and we were talking about this earlier related to other subjects, we have somewhat devolved, I think, in a way in recent years. We no longer want to talk about the tough subjects, the things that you can't boil down to a simple slogan or a soundbite and make your entire argument about that one little piece of it. It's a complicated thing, and part of that complication is so many people don't want to talk about it because they think they're going to be looked down on if they talk about it. And that we've got to get rid of that, I think, first.
Absolutely. And I think you hit the nail on the head. Mental health is a really complex issue. And I think sometimes, when people are trying to figure that out on their own, because they can't say, okay, it's this, and I know what to do for that. I have a cut, I put a band-aid on it. If I have a heart issue, I go to a cardiologist. It's not, doesn't feel quite as simple of a fix. And I do think too, there's a lot of kind of a misbelief that we have a lot more control over it than perhaps we do. And that stigma really only contributes to the fact that people have a fear of reaching out, and that's really the solution. It's talking about it, normalizing it, recognizing that it's so prevalent, and we're not alone in having mental health issues. I think 1 in 5 adults have some sort of mental health issue. I mean, think about that. There's probably 5 people in your office right now, and so
Well,
if you
this
think
is
about how
radio. It's way more. We beat that average, I have no doubt.
and so it's this is a very common problem, but it's not as commonly talked about, and that can feel really isolating, and cause, I guess, a contribute to that fear of reaching out.
Well, and I think you said something very important there that we need to pull out is that so many people, and a lot of this comes from how you were raised, how you were brought up, what you were taught in your formative years, everything from stop crying or I'll give you something to cry about on up.
Yes.
And that area of mindset, uh, there are things that are out of your control. There are things, and if you don't believe that, I've got a simple example to give you. Next time you're about to sneeze, choose not to. Let me know how that works out for you. Just shut it down. There's a very obvious example of sometimes your body does things whether you want it to do it or not. And that's magnified 100 times in the world of mental health. Your brain is going to do things you didn't tell it to do, you didn't want it to do, but here we are, so we have to deal with the facts as they are.
Absolutely. And you talk about like generationally, right? The coping strategies that are handed down. Well, if we didn't really talk about it, or maybe we talked about it as like, I had a spell, it's fine. I don't need to, we don't really need to dig into it. Then there's not a place for you to kind of learn, well, what is this actually called? And is it okay to have these feelings? And genetics, we don't have a lot of control over. And so if, grandparents, parents if it's seen throughout the ages, but labeled incorrectly, and nobody really talked about it or got any help, you don't have a whole lot of control that, that's likely to be expressed for you as well. And then of course there's, the outside of genetics, what we learn. Um, and so if that's to have feelings, to express what's going on, is weak. I hear that word a lot
I
in
was
these
about to
initial
use
sessions.
that word.
Yes, that I don't want to feel weak, and for me not to be able to just suck it up and move along is weak. And I'm going to tell you, the I've done this work for quite a while. The strongest and bravest people I've had the honor of being in their presence are in these rooms at Pine Grove with in treatment. Those are the strongest and bravest I've seen, because it takes a lot of strength to be able to be maybe the first one in your family to face a stranger and say, hey, I need to talk through some things and I need some solutions.
Well, and the other part of this, and this is why therapy and access to mental health services, and we're going to get to that in a second, is so huge, is because, and let me give you another example, another analogy. I think everyone has been in this situation or something similar. You've got a friend, you've got a sibling, whatever, and they've got a relationship and maybe it's not going too well, or they've got another friend that you can see it. It's plain as day. This isn't working. This isn't going to work. It's bad for them. They can't see it because they're too close. You cannot be closer to something than you are to your own brain. Other people with the right training and the right skills are going to be able to see things and say one sentence, and then you'll sit there and stare at the wall for 30 minutes going, wow, it really does work that way, doesn't it?
Yeah, I mean, and I think when you're in it, it's definitely hard to see. And something that's a little tricky is sometimes the people we seek, or the relationships that we're looking for in those moments are not necessarily, they feel like they work, in terms of like maybe I'm struggling with something and I find a person who seems to help me with that, but maybe the coping strategies they're bringing in aren't so healthy. So this feels like a great option, right? And to me, I'm starting to maybe feel better, but I'm feeling better through substance use because that was introduced to me. So, I mean, and so someone from the outside can say, well, wait a second, the long term picture here, is not great for you, and I care about you, and this isn't going to end well, or this is not so great. But the person in that moment feels like it's working, or it's fulfilling a need. Maybe it's blocking them from having to look at themselves, right? Because that's hard. And so, yes, it definitely takes um, an objective person, especially with training, to say, wait a second, there's a pattern here, or I get why you're doing this, and validating, like, I get why this might feel better in the moment, but let's zoom out a little and see how this is actually going to impact you in the long run. Or this doesn't seem to be in line with your values. Let's talk about that. Let's see if we can get you more in line with where you'd rather be heading.
Sometimes you grab onto the first life raft that floats by and you don't care that it's covered with fire ants. At least you're keeping your head above water.
That's exactly right. That's exactly right. It's a temporary fix that really may not be great, in the long run. And the other thing that when we were talking about kind of in generationally, like if you don't have a whole lot of coping strategies, um, that ability to withstand kind of the immediate distress. What is it? Short-term pain for long-term gain, right? Like if I don't have the coping strategies to be able to make it through that short-term distress that it's going to take to change behaviors to make it to the long-term healthy patterns, then I'm just going to kind of stay stuck in this cycle of the short term. Well, this feels better in the moment. And you're right, that life raft, it's not great and it's not going to last very long, and it's going to cause more distress and more pain.
Well, and the problem in that particular scenario, yeah, it'll keep you afloat for a while, but sooner or later you have to let go, and now you're back to drowning, plus you have fire ant bites, so it gets even harder to
Exactly.
make your way through it at that point. We are talking with
Exactly
Dr.
right.
Christina Williams with Pine Grove. It's Mental Health Awareness Month, and we will continue. When we come back, I want to talk about access to mental health services. and how big of a difference that can make in everybody's life, whether they use them or not, as long as they're available to the people that need them the most. We'll get into that when we come back here on Middays in the Element Wealth Studio. Dave Hughes here, and we have Dr. Christina Williams with us with Pine Grove, the clinical director of outpatient services there. And right before the break, I mentioned to you, and I want to talk about this, the access to mental health. And I'm sorry, it ain't that great in the state of Mississippi. I mean, Pine Grove is kind of the shining exception to that because it's phenomenal levels of care that you give, but it's not an option for everybody, if for no other reason than you've only got so much space in the building. We need more access to services. Am I right on this?
Yes, unfortunately. I mean, when you look at some of the statistics, right, like nationwide, some of the worst prevalence of mental health issues are the states that have the least amount of access for people to get help. I mean, that makes intuitive sense, right? And so, unfortunately, I mean, I think Mississippi is kind of right there in the middle. We're like, I think we were ranked like 21 in terms of access to care. And you know, we've got a lot of rural areas, and so sometimes for people to access care, they've got quite a drive that they've got to make, and it is unfortunate. I will say, interestingly, you know, COVID, while we actually saw quite an increase in mental health disorders. Even our patients who were receiving treatment, you know, we did see some of the severity increase. Um, but interestingly enough, COVID actually brought about a bit of an increase in access to care, which you wouldn't think that, right? Like people are not able to leave their houses. They're creating these little bubbles. They're isolating more due to fear of COVID. But what we actually saw was a dramatic increase in telehealth. And so, you know, these people who, you know, had to drive 2 hours to see us, the laws changed quite a bit in terms of what providers were able to do in telemedicine, and we were able to see more and more people through telehealth, and they're able to do it from the comfort of their homes. And a lot more people who never had access before were able to get that access. So it was, I mean, I hate to say that there's any pros to COVID, right? But it definitely was something that increased access.
And check me on this one, too, because I have no data to back this up whatsoever, but I have a theory that it wasn't eliminating the drive and eliminating the time that saw an increase in access to the health. It was an elimination of stigma. You didn't have to explain where you've been all day. You didn't have to tell anybody. You didn't have to get anybody to drive and bring them into this and admit to them that you had a problem. You can go in the backyard and get on the phone and take care of it, and nobody else has to know. So I think avoiding having to deal with the stigma kind of greased the chute to get people to seek out help, I think.
I mean, you're exactly right. That's definitely a component. That's something we heard too. I mean, we had people who suffer from something called agoraphobia. So they have a very significant fear of leaving their homes. And so, you know, for once, we were seeing them kind of reach out for help because they recognized, wait a second, you know, I don't necessarily have to face the things that I need treatment for in order to get the treatment that I need. I don't have to leave my home just yet. And so you're right. I mean, and that's for multiple disorders. You know, it's I have to call and I have to talk to somebody and tell them what I need, and then I got to show up in a clinic, and I've got to take off work, and so it absolutely created an easier convenience too. I can on my lunch break go down to the parking lot and have a session in my car, and then go right back to work.
And that's important because it needs, in my opinion, it needs to be as absolutely easy as we could possibly make it to reach out to somebody for help. Everybody has had a day where they wish they had somebody they could talk to. And what most people don't realize is that's what mental health services, that's what therapy is. It's somebody to talk your problems over with and give you an outside perspective from a learned state of mind and a learned perspective to where they can offer you authentic advice and see things that you're not seeing and kind of open your eyes. That's the whole point. But we have an entire segment of the population that thinks that, and I'm just going to say what they say. Only a sissy would go do that. Now, you've probably heard that before, haven't you, Doc?
Absolutely. Yeah. And I've had, don't tell, hopefully you won't tell anybody I'm in here, because people are going to say I'm weak. People are going to say, and it's a lot of the language of their family message, their friends. It's all of the things that people are saying about people who, seek mental health care. And it's so unfortunate. I mean, they're going to talk to someone, whether it's their wife or their husband or their friends. Usually there's some kind of conversation that's had. And wouldn't you rather the advice or the insight that comes back be from a perspective of where there's some training and, insight into that? And also, it's completely confidential. So, your friend that you've told this to, they're not bound by HIPAA. We are. And so, that's something that, I remind people of as we get started is like, I can't even tell people I know who you are. If I see you on the street, I'm not going to wave at you. Like it is completely confidential. And so like this story that you're either having to deal with on your own, or you're telling friends and maybe not getting as helpful of advice. I mean, don't get me wrong, friends can have helpful advice, but if things aren't changing, then why not go for this kind of very safe, confidential setting where you can get some tools and some strategies.
Well, and the other thing is, it sometimes doesn't work out the way you have it built up in your head that it's going to work out, because sometimes all you need is an objective perspective from someone to tell you, no, you're not crazy. You've got a point. I don't care what they're telling you. I don't care what they're trying to make you believe. You're not wrong. You're okay. Sometimes you just need that emotional backup, and that's another service that's provided through this.
Right. And I mean, I think one huge piece of the treatment that we do is normalizing. And I think people will very slowly kind of eke out information like, hey, I'm feeling this way. And then I had this thought. I mean, where do I need to go? What's happening? I mean, they think it's going to be the first time that anyone in the history of the world has said this thing out loud, right? And so, having somebody that goes, oh, I hear this every day. Wow, you're not alone. That must really be hard. And you've dealt with this by yourself for how long? It's that relief that you have that I'm not broken. I'm not the only one. This is not something that's unfixable. There's other people. I mean, we have group therapy that we offer here, and the amount of just support and recognition that the person to the left and the person to the right have these same thoughts and feelings that I've never told anyone is it's a tremendous experience, and it can feel really empowering to want to okay, well, if I'm not the only one and I've practiced these tools and these skills, then I'm going to talk about it more because it needs to be something that people are saying to each other.
Well, we could actually drift off into the whole concept of tribalism, how it's built into the human psyche to begin with, and lead you right down that path. But, we're off the air in 30 minutes, and I want to take up your entire day, Doc. But I do want to go back to something you said just a second ago. Barroom therapy is not nearly the solution you think it is, because when people are in a bar, they think they can dance, they think they can sing, and they think they have all the answers, and they're wrong about all three of them. That's why you have to seek out a professional in this case. If someone, and I'm not talking about someone who's at the end of their rope, although it definitely includes them, but you just seem to be having one of those days every day. Nothing that rises to a ridiculous level, something that you have convinced yourself, I just need to suck it up. This is ridiculous. Oh, I can't. You can still reach out for help. How do they do that?
This is such a good point. I mean, it's people feel like, well, I'm not to that level where, and they have some picture in their mind of what broken enough or bad enough needs, like what level they need to reach to actually ask for help. And I implore people not to wait till that point. because then, I mean, we definitely will lean in, we'll definitely provide treatment. But if the thing started unraveling 2 years ago, can you imagine if you reached out then? How, what we could have avoided, the trauma that we could have not added. And so, I agree. If people think that they've got to kind of like suck it up until it really is so bad that I can't take it anymore. And that's not the case. Um, I mean, honestly, if your everyday doesn't feel like it's in line with what you would like it to be, what your life, what you'd like that to look like, what your values are, what your relationships are like, if you're just going through the motions, why is that not bad enough to want it to change? And I think that's a concept that a lot of people really don't understand, that
Well,
you can get
and
help
I
really
think
early on.
we're up against a break. If you can hang on, I'll talk to you for a few more minutes. I know you've got nothing to do with your time other than talk to me, but can you hang on?
Absolutely.
Fantastic. And yeah, what's the risk factor here? You have a conversation? Ooh. Right. Well, we'll continue this talk. Wealth Studios, Dave Hughes, Dr. Christina Williams with Pine Grove Outpatient Services, who did not realize she was signing up for this long of a stint. But I'm sure she complained about it during the break. I didn't hear it, so it's fine. We can just move forward. We're talking about this, and this is a topic I'm passionate about, because I think the only way to do away with the stigma is to be passionate about it and to talk about it and to get the conversation going. And I was telling Rhino during the break when we were talking, the whole goal of this whole, 30, 40 minutes and counting, is that if one person hears this and goes, wait, okay, so we can actually talk about this? Really? Wait, hold on. That's it. That's the goal. That's the whole thing, because that's what starts the entire ball rolling on this. I would say probably that's the hardest part, is that very first admission that, hey, might do me some good to talk to somebody. I think that's the biggest hill to climb, isn't it?
Absolutely. And I feel like that idea that you brought up about like it has to be so bad, right? And I feel like hopefully I agree. If one person hears this and they think to themselves, first of all, that psychologist didn't look too scary, hopefully, and seems like a nice person, and like we can talk, and it can be just like a typical conversation, but except that maybe with some helpful strategies that that we've built some comfort towards the idea of just asking for help. Then I've done my job for the day, right? Like if this helps anybody know that it's okay to ask for help. It's okay to have these difficulties. Lots and lots of people have them, and that first step might be, kind of difficult, but it's an important one. And I think recognizing that you're not alone is a big deal.
Well, and the other part of that, the other side of the coin of stigma here is, when you said just then, that psychologist doesn't look scary, and you look like a totally lovely, wonderful human being. You really do. And it seems like you are. But we build things up in our mind. Oh, it's a psychologist. Oh, it's a doctor. Got to talk to a doctor. I'm going to tell a tale out of school on Dr. Williams. I'm going to see if I can get her to confirm this live. We didn't discuss this. You've burped before, haven't you?
Oh, burped, sneezed, you name it. Absolutely.
Several other things we won't discuss. Look, she's a human being just like you are. She just has training in a very specific area that can help people. And sometimes you kind of people will build it up as this you're almost like a mythical creature, Doc. It's a doctor of psychology. She's analyzing everything I say. Like, you don't do that every day. Every time the family gets together for Sunday dinner, that's just part of human nature. But the therapists, the doctors, the people, they are people just like you are, which means they can relate to what you're going through, because they have problems too. And that's
Exactly
something I think
right.
that gets lost in the conversation sometimes.
That's exactly right. I mean, we're not immune to having feelings, and we're not immune to feeling like at some point we needed to even get help outside of ourselves. I mean, the best therapists have done their own work. And so it's recognizing that this is something that even with my training, I need that outside perspective sometimes as well. And we're human, and this is just beneficial to get that support from somebody else. And it's not. I also think sometimes there's the fear of like, well, I've kept these secrets for so long, or there might be some sort of like family betrayal, or there might be some sort of fear that like I have to say that my parents necessarily didn't give me these things that I need, and I don't want to speak ill of them. And there is a lot of fear about like the things that I'm going to say out loud, what that's going to mean. But once those things are out there and you see that we don't run out of the room screaming, and we're not, like I said, we're HIPAA bound, so we're not going to tell anybody anything. You can actually take a minute and go, whew, okay, now that that's out there, that's great, because I can get some help with that. I can get some strategies. It's not something that necessarily broke anything. And I had all of these fears built up about what was going to happen next if I actually spoke about these things out loud.
Well, I am hereby declaring the official formation of the second law of emotional movement. Emotions and problems suppressed tend to stay suppressed. Emotions and problems that are in motion, moving towards a solution, tend to continue moving towards a solution. You just got to give them moving first. And that's all you have to do. It's simple. It's easy. And again, as I said right before the commercial break, what's the biggest risk you're running here? The absolute worst that can happen is you have a nice conversation with a lovely person you never talk to again. You did that in line at Walmart yesterday. That's not a big hill to climb. And nobody else will ever know you even had the conversation. So it really is not the problem everybody builds it up to be in their mind, to look for a little help.
I mean, exactly. I think that what's interesting is we're also probably having like the conversation you had in line at Walmart. You're having that conversation with yourself all day. And those thoughts are, like you said, they're not necessarily going anywhere. They're being suppressed, or we're just allowing them to continue to spin and not breaking that cycle. And with each cycle, maybe we're adding something even a little bit more negative in our self-talk. So it's just getting worse and worse. And so, like, actually changing that narrative that you're telling yourself by including someone else's thoughts in that, like, hey, I've really I've been struggling with XYZ, and I really feel like it means this about me, and I can't get that out of my head, and I've not only been thinking that, I'm behaving based on that belief. And so maybe because I have this negative self view, I'm not engaging in things I'd really like to. I'm hiding from the people that I love, because I think this thing is true about myself. And it's just this vicious cycle that without an outside perspective, that conversation you're having with yourself over and over is just going to get worse.
Look at it like this. If you have like a big bump that appears on your shin and it doesn't look good, I mean, it's got that red ring around it, it's turning dark in the middle, it's horrible, and somebody, you go to the doctor and they come in and they tell you exactly what they think is wrong. And they tell you, oh, well, it's this horrible, horrible rare disease, and you're going to have 6 months of surgery, and you're going to have to do this, and you're going to have to change everything about your life to deal with this. What are you going to do? You're going to get a second opinion. Why wouldn't you want a second opinion on what you've already decided about yourself?
It's exactly
It's just
right.
as important.
Right, right. And an opinion too that's going to be kind and caring. A lot of times that voice is not so kind and caring, because we're really, really hard on ourselves. We feel like because we're having these human experiences that maybe aren't the ones that we're posting on Instagram or the ones that we're posting on Facebook, it's not the highlight reel, that it means something really bad about us. And so that self-talk, it'd be really helpful if we could get some care and some kindness and some normalizing in there, to help break that. And then if we can change the beliefs we have about ourselves, then our behaviors are based on that. And that's when it's really cool to see that people start engaging in the things that they care about because you were able to first address that really negative cycle that was keeping them from that.
And I want to make one thing perfectly clear, too. I love Pine Grove. I love what you do. This is not a commercial for Pine Grove. I don't care who you go to in terms of a licensed professional. Just if you feel like you might need to, if you feel like it's a possibility that you should, do it. I don't care where they're at. I don't care who they're at. And I'm pretty sure that Dr. Williams will agree with that.
Absolutely. I mean, if it's, I mean, the other thing too that's to think about is a lot of people, I'll even say, look, if you've seen your PCP for 10 years and that's the person, like your primary care provider or your pediatrician or the person that you've seen for 10 years for your medical issues that you've built some comfort level talking to them about, bring up the anxiety and depression that you're having. Bring up, like, I'm noticing that I just don't care about the things I used to. We work very closely with a lot of our medical professionals. We give them screeners. They're asking these questions. They have knowledge of, okay, well, you know what? I know a great person. Let me give you a referral.
Just that simple, just that easy. I am going to let you actually get back to your life now, Dr. Williams. She agreed to a 12-minute interview. An hour later, she's like, this guy won't shut up. But I do appreciate you taking the time because I think it's important that people hear these things. And I really am appreciative of you taking the time to help get this message out and kind of destigmatize things just a little bit. Keep up the good work, okay?
I appreciate your time as well. Thanks so much for doing this.
Anytime. Glad to do it. It's Mental Health Awareness Month. Are you aware of your mental health? If not, you're not celebrating properly. You need to get to it. We'll continue final segment of Middays in the Element Wealth Studios next.